I'm Jonathan Nelson for the New Jersey Academy of Family Physicians with a special report on the physician workforce and graduate medical education. New Jersey, as well as the country at large, faces a serious shortage of primary care physicians. This shortage is only made worse by the poor distribution of physicians we have. Many physicians choose to practice in affluent suburban and metropolitan communities, leaving patients in rural and inner urban communities with few options for primary care and preventive services. Confronted with the prospect of reduced payment for those services and saddled with considerable student debt, fewer and fewer graduating medical students choose to pursue careers in family medicine. Unless something is done to bring more new family physicians into the pipeline, this critical shortage will only worsen as many practicing family physicians reach retirement age.
I think the reason the number of students who are choosing family medicine is decreasing is because of the salaries and outcomes that they're going to get. The cost of medical school, the burden of medical school is just overwhelming for students.
I think the size of the debt burden is just so high that they really think much more about which specialty they're going into than when I did.
What's hard, what the students that rotate with us see, that we're very busy and that we deal with a lot of issues, and that scares some of the students. The flip side is that we're not compensated financially as well as some specialists are.
High-performing healthcare systems have a very large base of primary care as their foundation. And in New Jersey, we don't have that, unfortunately. So we're faced with difficulties. The medical schools tend not to want to train family medicine. Our family physicians, we don't get access to the medical schools as much as we should, and despite our best efforts, specialists hold sway in that area, unfortunately.
Family medicine residency programs do more than just train the next generation of family doctors. They also provide much-needed care to uninsured patients and to those receiving coverage through public programs.
We are trying to train the 21st century young physicians to serve the whole community.
This office and this residency program is the lifeblood of this community. We serve just about every member in the southern part of the county.
I think the crisis about graduate medical education is a perfect lesson in penny wise, dollar foolish. For the investment that you make in primary care in terms of training learners in a high-quality program like ours, by taking that money away on the back end later, you're going to have devastation in terms of lack of care to so many patients who otherwise won't get it, who will now then overutilize emergency rooms for Band-Aid care.
Many recent studies have shown that in areas where more of the care is delivered by family physicians, patients receive better care and better outcomes at a lower cost. That's why your academy is working in the state legislature and in Congress to make sure we have adequate funding for graduate medical education so we can attract, train, and keep the family physicians we need.
I let students know that there is a future for family medicine. Absolutely, we just have to fight for it at this point.
I think there's many things that the community and the nation can do to help family physicians, including reduction of the interest rates for their medical school debt, or perhaps some tax rebates, or some type of incentive financially to offset the high burden of debt.
American families and individuals need to have access to primary care physicians, and to the extent that we can do things here in Congress to hopefully make it easier for people to practice in those general areas, I think it would be very important that we do so.
For more on what your academy is doing for you and to learn how you can get involved in the fight for family medicine, log on to the Academy's website at www.njafp.org. For the New Jersey Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in Action.